The occupational therapy program at Bay Path has a deep commitment to the community. In fact, the roots of the profession go back to serving individuals in the community. Most of the graduates stay right here within our own community. They're educated here, they do their clinical affiliations here. Through their education, they do service learning and community based learning here, and then they generally stay within the area. The focus really is on helping people remain in the community. Things like aging in place and helping people be able to stay within their homes for as long as possible. Occupational therapists work with people across the lifespan. There's often a perception that we work with people with disabilities only, but there's a push in the profession for health and wellness and prevention, which we didn't have before, so we can work on some of those preventative areas rather than just simply addressing disabilities.
The Springfield Boys and Girls Club is located in the north end of Springfield, and we've been around for 123 years. So we've been serving kids in the city who need us the most for over a century. So we rely on volunteers from the community who can come in and bring their expertise in areas we may not have. We don't have a social worker on staff. We don't have an occupational therapist or a physical therapist on staff. We don't have some of these experts who can really address issues with kids that go beyond what we're able to offer them. So having the Bay Path students come in and work with our kids one-on-one and in small groups provides our youth with a whole nother level of service that we couldn't provide otherwise. The OT students within the Boys and Girls Club are invaluable to what we do. Being able to have students come in and work with our children who may have issues such as ADD, ADHD. We have children who are on the autism spectrum that come every single day after school. And having people who come in with a wealth of knowledge about what kinds of activities might work with these children and figuring out new ways to engage them and really having a whole level of compassion and understanding for their individual needs is a really nice add-on to what we can already provide. The Bay Path OT program has been volunteering for the Springfield Boys and Girls Club for many years. We need people like the students at Bay Path to help us meet that mission.
Bay Path's physician assistants are prepared to enter the trenches, roll up their sleeves, and be part of the solution to the healthcare issues in our region. They answer to a critical need in our community. I've always felt medicine is an intimate discipline to teach, and Bay Path's program and small group learning environments prepare them for practice in the future. The physician assistant in that physician-guided team approach provides the ability for a practice to increase its access and efficacy of care to all of the patients in the community. Our PAs are trained in the medical model to follow their patients across the lifespan that will absolutely contribute to every patient here in Western Massachusetts. The healthcare statistics in Western Massachusetts rank closest to the bottom in the entire state of Massachusetts. The physician assistant program here at Bay Path has chosen the mantra, part of the solution. We certainly strive to be part of the solution and make Western Massachusetts a better place.
Caring Health Center has been in existence for about 20 years. So currently right now we serve about 14,000 patients. We have 50,000 annual visits. The goal, of course, is to increase that by 100,000 visits. Provider recruitment tends to be a problem all over in terms of the city of Springfield, especially because the city of Springfield has been designated a medically underserved area. We cannot survive without a physician's assistant. A physician assistant sees up to 16 patients per day, and those visits vary. Those visits can be a complete physical exam, it could be a regular 15-minute follow-up or a checkup. At our facility, it could be a refugee assessment, and so they're pretty busy. BayPath PA Physician's Assistant Program is definitely something that is needed within the city.
Our programs are deeply embedded within the community. Our faculty are out in the field on a regular basis, and they bring their learning back to the classroom so that our training reflects what is most needed and relevant. And we are dependent upon these community partnerships. We simply could not run our programs in the health sciences without the strong partnerships we enjoy